Good morning and welcome to this webinar on the state of social protection for agri-food system workers in West Africa. My name is Ana Ocampo. I'm the Regional Social Protection Advisor for WFP at the regional bureau that covers Western Africa, and I'll be moderating this webinar today. We're glad to inform you that this webinar has French, English, and Portuguese interpretation. You can access the different languages by clicking on the globe icon on your Zoom panel, so just below my camera, I think. Please note that as an attendee, you cannot open your mic or camera during the webinar. But we want to hear from you, so please share your thoughts, your questions, your inputs through the chat box. You can share questions to the panelists through the Q&A box that's open to you during all of the webinar, and we will try to answer all of your questions during the Q&A session of the webinar. This webinar is organized by IPC-IG, FAO, and ECOWAS in collaboration with socialprotection.org. The objective of today's discussion is to present the findings of a research project, which are also going to be captured in a report on the topic of the extension of social protection to agri-food system workers. And this webinar will create a space for dialogue between national governments, UN agencies, international and regional organizations, and civil society from the West Africa region, aiming to inform the future policymaking to enhance social protection for agri-food system workers in West Africa. And to kick us off, we are going to start with introduction from Mrs. Bintia Stephen Tchicaya, Mr. Gouantoueu Robert Guei, and Mrs. Sintiki Tarfa Ugbe. I will first start by giving the floor to Mrs. Bintia Stephen Tchicaya, Senior Policy Officer at FAO. She's FAO's sub-regional in the sub-regional office for West Africa. She's program leader for social protection for Africa. I will now give you the floor. Over to you, Bintia.
Thank you very much, Anna. Thank you for your time. I would like to welcome all of the panelists today and also welcome all of the participants that are following us today. For this webinar on social protection for agri-food system workers in West Africa. So what does the situation of food systems in West Africa look like? Essentially, in the West Africa region, most of the population is really dependent on food-related activities as a way of making a living. The food system in West Africa is evolving very quickly, also creating new job opportunities and representing 40% of the regional GDP, around $260 billion US. According to the Sahel and West Africa Club Secretariat 2021 report, the food system in West Africa accounts for a majority of jobs, which is around 66% of a total employment as of their records of 2017. And this same report states that 78% of occupations in West Africa are in agriculture, while 15% are in food marketing and 5% are in food processing, thereby really accentuating the concentration of the West African population in the agri-food systems area. So what are the issues that some of these agri-food system workers are facing in West Africa? There are multiple issues. First of all, that threaten livelihoods, including economic fragility, conflicts, limited access to agri-food production inputs, high mobility, informality, post-harvest losses, and global trade and restrictions, predominantly due to COVID-19 and the recent conflict between Russia and the Ukraine. In the face of low and irregular incomes, remoteness, and marginalization, many agricultural workers, including fishers, foresters, and pastoralists, are prone to additional risks, such as natural disasters and climate change impacts. So life cycle risk for people living in rural areas are generally the same as for those in urban areas. However, the former tend to engage in livelihoods and income-generating strategies that tend to be more risk-prone. Agri-food system workers, on the other hand, face a number of specific risks regarding social, health, economic, and environmental segments. Rural communities are often politically and socially excluded, which leads to difficulties in accessing formal credit, high unemployment rates, weak protections from labor markets, lack of land rights, and land access to several public services, such as education and healthcare. Events such as floods, droughts, pollution, and land degradation, as well as climatic changes, can heavily affect agri-food systems workers, compounded with the seasonality of the work. The West Africa region is also threatened by long-term socioeconomic impacts due to the highest rates of population growth in the world. It is projected that West Africa's population will grow by 135% from 400 million in 2020 to 540 million in 2030. Regardless, to say that the needs regarding social protection will become even more. Considering, therefore, these risks, agri-food system workers in West Africa are in clear need of social protection, which has been proven to have positive effects on food security, nutrition, and human development. Moreover, social protection can play a crucial role in reducing the risk of the poor and most marginalized communities who often rely on negative coping mechanisms, creating and protecting their assets and enhancing their economic and productive capacity. Adaptations of social protection schemes for agricultural workers in general are necessary to provide a response to many aforementioned risks, in particular through their availability, affordability, accessibility, and quality. Benefits in general that could target agri-food systems workers can vary by providing income generation activities in the sector, linking school feeding programs to local production, including shock responsive elements that target resilience against climate and environmental changes, which can impact agri-food system workers. Despite the recognized importance of social protection, however, its coverage in West Africa is still considered extremely low. Therefore, dear colleagues, dear participants, and dear panelists, we look on to your guidance today so that you can tell us how we can help our governments further strengthen and improve the social protection systems and put the right mechanisms in place. Over to you, Anna. Thank you.
Thank you very much, Bintia, for these words. I would like now to give the floor to Dr. Robert Guei. He's the head of the FAO's Regional Office for West Africa and FAO Resident Representative in Africa. Robert, the floor is yours.
Yeah, thank you very much for giving me the floor. Dr. Sintiki, Director, Humanitarian and Social Affairs, ECOWAS Commission. Dear panelists, dear participants, ladies and gentlemen, I'm pleased to take part in this webinar on the state of social protection for agri-food systems workers in West Africa, jointly organized by FAO, IPC-IG, and ECOWAS. I want to extend a warm welcome to all of you who have joined us today. First of all, I want to express my gratitude to ECOWAS for collaborating with us on organizing this event and for the continuous and privileged partnership with FAO Sub-Regional Office for West Africa. I would like also to express my gratitude to our government counterparts who have contributed to the report and agreed to speak on today's panel. Allow me to thank the International Policy Center for Inclusive Growth, who joined forces with FAO Sub-Regional Office for West Africa in this important project to take stock of the state of social protection schemes for agri-food systems workers in the region. Finally, I want to thank our sister agency WFP and ILO for the precious contribution to this report. Ladies and gentlemen, West Africa has seen remarkable progress in socio-economic development in the past 2 decades. In spite of this growth, it still experiences high levels of poverty and inequality, food insecurity and malnutrition, high maternal and child mortality, high levels of informal employment, conflict, and the impact of climate change. These challenges and COVID-19 pandemic have raised the urgent need for effective and efficient measures to assess social protection for all. African policymakers and institutions are conscious of the need for the adequate extension of social protection coverage on the continent. Recent estimates show that Africa has the lowest social protection coverage in the world, 17% of the total population, compared with the global average of 47%. This is why the FAO strategic framework for the next decade provides a clear path to sustainably transform all agri-food systems to make them more efficient, inclusive, resilient, and sustainable. It supports the goal of the 2030 Agenda for Sustainable Development and guide FAO's work to achieve better production, better nutrition, a better environment, and a better life, leaving no one behind through social protection programs and its contribution to enhancing the economic and productive capacity of the poorest and the most marginalized in rural areas. Ladies and gentlemen, I hope the findings of this report will inform policies designing and implementation of integrated and inclusive social protection systems in West Africa in order to ensure adequate and comprehensive coverage and support to rural areas and agri-food workers. I wish you a fruitful session. Thank you.
Thank you very much for these words. I will now give the floor to Dr. Sintiki Tarfa Ugbe. She's the Director of Humanitarian and Social Affairs at ECOWAS. Dr. Sintiki, the floor is yours.
Thank you and good morning. Permit me to recognize the presence of the sub-regional director at FAO at this very important meeting, and all the FAO team, the ECOWAS team, and distinguished experts and partners from our member states. Good morning to you all, or good afternoon wherever you are joining us at this very important webinar on the dissemination of findings of the state of social protection for agri-food workers in West Africa. On behalf of the management of the ECOWAS Commission, most particularly the Commissioner, Human Development and Social Affairs of the ECOWAS Commission, Professor Fatou Sosa, it gives me a great pleasure to be with you today and to participate in this very important webinar to hear the findings as well as the results of a study commissioned by the Food and Agricultural Organization Sub-Regional Office for West Africa to assess how agri-workers in West Africa are reached by any social protection programs. These social protection programs, as we witness from many governments worldwide, including most countries in the West African region, were a key part of their measures to address the devastating impact of climate change and COVID-19, resulting in the loss of lives, loss of household income, deterioration of livelihood, and increase in food insecurity. I'll also add, increase in the food and nutrition crisis that we have, particularly now in West Africa. In particular, the rural areas where majority of our population live and are involved in various farming activities, producing the food that feeds our countries. We observe sadly that most, if not all, these rural populations were not covered by any social assistance programs. West Africa is also the region where we see a high level of migrant workers in agriculture and who also require access to social protection, such as health coverage. Evidence from other countries outside our region has shown that social protection plays an important role in enhancing food production and nutrition, including building social cohesion, building resilience, and enabling households and communities to withstand future shocks. I think all of us in West Africa should be very, very concerned that as we see conflict, as we see climate emergency with the flooding, devastating livelihoods and farmlands, we should now start to reflect what is going to happen to a vast majority of our population that depend on agriculture for their livelihood, for their income, and to support their families without any form of social safety nets to protect them. At a time when ECOWAS, therefore, is updating its social protection framework, this important investigation and the study and the results of the study is helping us to understand better the vulnerabilities and risks of agri workers and rural households, and showcasing good practices of coverage from countries within the West African region. This is both timely and very critical as it provides evidence-based data and information that will help make our COVID recovery efforts meaningful in the West African region. Additionally, it will enhance efforts towards the achievement of universal protection coverage as called for in the recently adopted African Union Protocol to the Human Rights Charter of Peoples on the rights of the citizens to social protection and social security, and in the fulfillment of our continental aspiration of the Africa that we want. Let me conclude in expressing our thanks to FAO for initiating this very important and relevant study to our region, the IPC-IG team that carried out the study, and all the partners that supported this very important and relevant study. We look forward to the discussion and the recommendations that will not just enhance the social protection framework, the regional social protection framework that we are developing, but will also enhance the work that our member states are doing at the national level to ensure and enhance food security for all. I thank you for listening to me, and I wish us all a very fruitful deliberation at this important meeting. Thank you.
Thank you very much, Dr. Sintiki, and thank you to our three speakers for kicking off this discussion by so neatly highlighting what is at stake here, the potential of social protection investments on human development, but also production, and why this is so relevant for agri-food system workers. But also highlighting the challenges at hand, including on issues around coverage and the challenges that the current global food crisis poses for agri-food system workers and their families. We will then move on with the rest of the webinar. The researchers will present the findings of their report, and we will then invite speakers from the countries that were chosen as case studies for this study to also give their views on the topic, and then we will have some time for Q&A. So I will now give the floor to the researchers, Gabriela Perin, researcher at IPC-IG, João, Pedro, Dytz, and Nourjelha Mohamed, also researchers at IPC-IG, who conducted the study. The floor is yours.
Thank you very much, Anna. Thank you very much, Bintia, Sintiki, Mohamed, for the presentation at the start and for setting it up. So as you can see, the goal is to present the future report that will come out on the state of social protection to agri-food systems workers in West Africa. So first of all, as you can see in this agenda, the next slide, please, we will present different steps, the social insurance, the social assistance mechanisms, some selected case studies, and the conclusions and recommendations. Sadly, our colleague Nourjelha couldn't show up. She has had some internet connection issues. So the social assistance, I will present also the social assistance part, but we can already start with an overview of the social insurance in West Africa. So for the overview, in the next slide, you can see already the coverage numbers that we have managed to gather through Aspire's database. Some of the issues that we have working with the region, working with this topic, is the data limitations. We try to do this disaggregation when we could between the coverage between rural areas and urban areas, but we don't have necessarily details on the work sectors themselves, so which would target the many agri-food systems workers that were mentioned at the start by our colleague from FAO. And as you can see, generally there's a low level of coverage. Ghana is a bit overrepresented here thanks to their health insurance mechanism, but which means the coverage ends up being higher than the others that you see, but it would be a bit lower when you don't consider necessarily healthcare insurance. And one of the main things that you can see, and that was mentioned, are those high rates of informality, particularly in rural areas, which limit the access to social insurance. Well, a lot of categories of workers that we'll be examining here will be those informal workers, seasonal workers, self-employed workers that constitute a lot of the workers in the agri-food system. So to start off, we will talk about those maternity benefits. In the next slide, please. Here at the right, you can see which countries use the social insurance mechanism, which depend more on employer liability schemes. Some have two, depending on the, as you can see, Guinea and Togo have two because of both social insurance and employer liability, depending on their system, depending on which type of worker you are. So when you see something with the employer liability, there are some issues regarding this because it depends solely on the payment from employers. So you have an issue of unequal treatment of women in the labor market. The recommendation here is having a public fund or something that's collectively insured, such as a social insurance mechanism. And the coverage in general from most countries is very low. In the case of agri-food systems workers, only 3 countries here explicitly include the workers in the agricultural sector. These are Guinea, Nigeria, and Togo. Some exclude them, like Benin. Self-employed workers are also limited in their access. Only 3 countries mention those women, and informal workers are very often excluded. So passing on to the work injury insurance, we'll try to go a bit quicker. More details will be in the report. But so on the next type of benefit, the work injury insurance, we have this important, of course, because of the hazardous nature of this type of work. All countries do have it, but once again, employer liability schemes happen in 3 countries, or in Benin and Burkina Faso, they have a mix of both social insurance and employer liability. And you also have some broader systems. For instance, as you can see, Cape Verde's coverage is very high, and they have a very broad system where sharecroppers are included, tenant farmers are included, and yeah, sorry, and some other include just a bit, like Guinea-Bissau includes some agricultural workers, includes self-employed workers. So you have very different schemes across the region. One issue that we also have a lot with rural areas is that verification and control is very limited in those areas. So many might not be able to receive even if they are eligible. So regarding the next one, which are cash sickness benefits, once again, as you can see, only 4 countries end up having a social insurance mechanism, which is a quite important benefit to guarantee income in case of sickness. Most of all, if you're unable to work during the when you're able to collect the food, when you're able, this affects very negatively this type of work. And in general, this is the system that we saw that was more restrictive towards workers. Most of them excluded self-employed workers. Only Cape Verde and Guinea-Bissau did include those. Nigeria did explicitly target workers in the agricultural sector. Benin had a special system for seamen and fishers. So this is it for cash sickness benefits. Regarding unemployment protection, something that's interesting here in West Africa is that all countries except Cape Verde have a severance pay mechanism or a withdrawal for fund. So you don't have a common fund that allows for unemployment benefits, which limits the severance pay is only being paid by the employers themselves. And this has a high issue of exclusion of the informal market, of self-employed workers, which are never included in this. And yeah, so you have different levels of benefits, different levels of inclusion, what will be considered an unfair dismissal, what can be considered economic reasons, and it's integrated. So a lot of countries have different systems here, but in general, the coverage is very low, and the agri-food systems workers are very often excluded. So on the next one, for old age pensions, as you can see, they vary a lot. They are generally low. Cape Verde here, we'll mention it a bit more further ahead, but it's the high coverage is also because this includes the social assistance mechanism, the social pension they have, but they also have broader systems. They have 3 countries which explicitly includes agricultural workers, 5 countries which explicitly include self-employed workers, but more than half, 8 countries exclude them. And informal workers are very often excluded, and they are not able to participate in this kind of things, except from the Cape Verde. So regarding the next one, and the last presentation that we'll do are on child and family benefits and family allowances, which has a very strong impact on reducing child labor. This is interesting also because there's a lot of linkages with social assistance, which is the next step, which we'll be presenting. And the higher coverage often depends on non-contributory system. You have one that's very broad here that we would like to highlight is Togo, which includes salaried agricultural workers, self-employed workers, seasonal workers, temporary workers, and even informal workers, which means that coverage ends up being able to reach more people. So to conclude with the social insurance part, we have an issue that legal barriers often exclude sectors of agri-food workers. Self-employed workers are often excluded. Informal workers are not able to be included. So you have those kinds of barriers. And because of their income, as was mentioned at the opening statements, that's an important obstacle for their contribution. You have administrative barriers, which don't allow necessarily for contributions to be collected, for benefits to be provided, and the access to service themselves that you might be interested in, and social services, public services, is often reduced in rural areas. So when you go to the next one on social assistance mechanisms, which I'll also present quickly. As you can see, coverage varies quite highly in the region. You have some that reach more than half of the population, some that reach barely 2%. Once again, we have some limits regarding the data that we have, so not all countries are included. But we show that we also can see that differently from social insurance, coverage of social assistance in West Africa is much higher in rural areas, where the concentration of agri-food systems workers is higher than in urban areas, even if they just do exist. That's some of the criteria that we end up using. So we also managed to study a bit the adequacy of the social assistance programs in West Africa. In the next slide, please. So which is the value of support provided under social assistance programs and how it meets beneficiary needs. On the next slide, please. Okay, thank you. It was not updating on mine, sorry. So as you can see, most of them are below 10%, are around 10%. The average one is of 10.3%. We had a question with Gambia why it's so high. It depends on other social assistance benefits, and we did not necessarily find which one that was. But yeah, so we have also in the examine in what we examined, that adequacy was higher in this case in urban areas. Cash benefits were more adequate and managed to better cover in the population in urban areas. And cash transfer interventions have the highest adequacy value compared to others. This is also linked a lot with the finance part, which is the next slide, which we use through UNDP's social assistance database. The average spending value here is of the gross domestic expenditures here, not the gross domestic product, but the expenditures themselves, is of around 0.69%. And 8 countries do spend less than 1% of their GDP on social assistance. So as we have provided this general picture, we would like in the next part that we will look in detail some of the 40 programs that we mapped that are currently active. So the main ones, as you can see, are cash transfers, public works, school feeding programs. We have analyzed the programs due to on their sensitivity to agri-food workers' needs and characteristics. We have looked at the 2 criteria: how do they target agri-food workers or not? Do they benefit them? And we have also some special benefits that we have considered. I'll present that a bit later. And when we apply this criteria on the 40 mapped program, the majority of them do target rural or poor areas, which makes sense once the selection of beneficiaries is often done exactly by trying to, when financing is limited, is often done by selecting the poorest areas, which are often rural areas as well. Okay, sorry. And yeah, so among those 33 programs, we only have 9 programs which explicitly targets agri-food systems worker, and more than half of those programs include at least one benefit. We'll see that a bit later. But going on the next slide, we can see that the majority of social assistance programs, as I mentioned, have those types of benefits. They do target those 9 of them explicitly target agri-food systems workers, and more than half of the programs include at least one of those benefits. Can we go to the next slide, please? Sorry, since it wasn't me, I thought the order was opposite. But yeah, so as you can see, the benefits that we considered are if they had some sort of skill development, training sessions, extension services, income generating activities. If in the case of school feeding programs, if they had procurement of food from local producers, if public works were related to agri-food sector, in particular if they invested in the infrastructure to it, and if programs had a shock responsiveness element that would assist in mitigating effects of climate change or environmental related shocks. So as you can see, this is a bit of the division. Most of them did have something on, as you can see. So to the next slide. Okay, yeah. So those are the main challenges that we have found. We have found on one side institutional and coordination challenges with constraints on the capacity, technical, financial, etc., of the systems themselves, and the coordination between the agricultural entities and social assistance providers is limited. We had some good cases that Gabriela will present later. You had also the fact that social assistance programs are not necessarily prioritized in the national budgets, as you have seen. They are also often commonly allocated to particular socioeconomic groups, which are usually more vulnerable, the elderly, persons with disabilities, children, and there's a lack of continuity of the programs in the countries, which is impacted by changes in governments. And finally, regarding the design themselves of the programs, agri-food systems workers are rarely explicitly targeted by social assistance programs in Africa, since they are often this part of some sort of missing middle, since they have access to work. They are not that poor, but they are also not they are not able to integrate social insurance mechanisms. The adequacy of the transfer benefits is often lower in rural areas than in urban areas. Have benefits that are often not directly relevant to agri-food systems workers and not able to cover their main needs. And there are gaps between the programs and when they're implemented. So that's an issue that we try to see as well. So that's a bit it for the social assistance part. Next, I'll give the floor to Gabriela to present some case studies. Thanks.
Thank you, João. Now we'll present the selected country cases on the next slide, please. Of the existing social protection programs, which are considered good practice for agri-food system workers. So in the social assistance programs, we selected 4 country cases: Ghana, Mali, Senegal, and Cape Verde. And in social insurance schemes, Cape Verde and Côte d'Ivoire were chosen. The first social assistance program is in Ghana. On the next slide, please. It's the labor-intensive public works that is under the Ghana Productive Safety Net project, which provides a short-term employment and income-generating opportunities to rural poor households during the agriculture off-season. It benefits agri-food system workers because it explicitly targets rural poor households and provides income during periods when there is a shortage of labor demand and in response to external shocks. There's a research that showed that LEAP has a positive impact in the value of crops produced, but one of the challenges is that the wage rate is below the minimum wage, which is some of the complaints from the beneficiaries. The next program is the Mali Social Safety Net, GGCMGI, which provides a bi-monthly cash transfer to poor and food insecure households, accompanying measures, and there's also 2 components about public works and income generating activities. This program benefits agri-food system workers by facilitating the access to free healthcare. The money used on the cash transfer is used for beneficiaries to use mostly food. The LEAP, the labor intensive public works, target exclusively vulnerable groups, which is women and people with disability, and they are offered a temporary job in the areas of agriculture, livestock, and fisheries, providing a remuneration. and also the income generating activities, which targets the small and subsistence agriculture workers, usually women, also providing some remuneration. So this is very beneficial for this category of workers. And some of the challenges the program faces is the administrative constraints, also the security situation in the country, the socio-economic crisis, and the COVID-19 pandemic. The next social assistance program is Senegal National Program of Family Security Grants, which provides a cash transfer for extremely poor and vulnerable households every 3 months for 5 years. And it's beneficial for agri-food system workers because all beneficiaries of the program have access to healthcare coverage. The payments can be withdrawn in all 14 regions of the country, and now they are starting implementing digital payments. The program has an integrated approach with other social assistance and also some productive social protection programs. And there's still some challenges regarding difficulties with payments and lack of information about the criteria of the targeting and also the program duration that benefits face. On the next and last social assistance program is Cape Verde Social Pension, which provides a monthly pension to children or households, people aged 60 years over, and disabled individuals that are not covered by any other social protection scheme, and offers also an annual amount for medicament assistance, funeral subsidy, and also a regular income, which is very beneficial for agri-food system workers, especially during drought periods, which may be the main source of their resources. Some of the challenges is the large demand on rural areas. Now with the social insurance mechanisms on the next slide, there's also a case from Cape Verde, which began reforming the law to regulate the social insurance scheme for independent workers in 2009. They have a category called self-employed workers, which includes farmer, agriculture workers, and independent workers, which contribute with 19.5% of monthly income and have access to a comprehensive package of benefits such as disability, old age, sickness, maternity, and surviving pensions, which match almost all the benefits for employed workers. So this is a very beneficial for agri-food system workers, but the program still faces some problems with low coverage, and this is being solved with a more proactive communications campaign. And the last country case is from Cape Verde. On the next slide, please. With the extension of coverage to the 2 mandatory social insurance schemes regarding also the health scheme to include workers in the informal sector, and that includes the rural workers. The beneficiaries has access to benefits such as sickness, injury, accident, and maternity leave, old age pensions, and surviving benefits when they contribute to 12% of the monthly income. And that's also a very comprehensive package of benefits, and that includes the independent workers that are mainly in the rural areas. Some of the challenges that these mechanisms face is the unavailability of administrative documents for poor households, and also the availability of digital tools. On the next slide, please. To finalize, we have drawn some conclusions. So as you could see in the report and the presentation, West Africa countries still face some coverage problems, which generally are very low to provide social protection as schemes and programs for agri-food system workers. Some programs lack the specificity to target these workers, and sometimes when they do target, they limit it to farm and livestock, which doesn't has the whole idea of what is the concept of agri-food system workers. There's also some problems with the lack of basic services in remote areas and lack of shock responsive aspects in the region. We draw some recommendations for these, especially regarding some gathering of data that is specific to these workers about their needs and capacities in order to provide mechanisms that are more focused, and also to promote mechanisms in legislation and regulation that allow them to better integrate informal markets, and also to have adaptations depending on the seasons to accompany these works. Also, some investment in infrastructure is a recommendation, and also mechanisms to mitigate disasters and shocks that are frequent in this region. Thank you so much.
Thank you very much, Gabriela, and as well as João for this very comprehensive presentation. I think this is really such a valuable piece of research, considering that lack of data in the region is really predominant. So I think that this study will really shed light on the needs and the actual coverage of agri-food system workers to really influence policymaking and reforms in the sector. For the next section of the webinar, we're actually going to hear from the practitioners and the policymakers around the cases that Gabriela just presented. And we're inviting 5 panelists to join us now. We have Koffi, Eugène, and Dytz from Côte d'Ivoire. Koffi, he's Director of Planning, Coordination, Project Monitoring and Statistics at the Ministry of Employment and Social Protection in Côte d'Ivoire. Eugène has been working on the topic of the expansion of coverage to rural workers and a champion in this cause in his country for many years. George Quado Sei Ababio, he is National Coordinator of the Productive Safety Net Project with the Ministry of Local Government and Rural Development in Ghana. So there were some questions for him. I'm sure he will be able to answer those. We also are going to hear from Mahmoud Ali Sako. He is the coordinator of the Social Safety Net Program Didi Semedjiri in Mali. We also have online Papa Malik. Oh, sorry, yes, I wasn't following the slide. We have Papa Malik Ging, Director of Management of Social Safety Net Program Senegal. So he will be able to talk to us about the Programme de Bourse de Sécurité Familiale. We also have, next slide, please. Sorry, we also have Marcelino Monteiro, Director of Contributions and Collection at the National Institute of Social Security of Cabo Verde, and Mahmoud Ali Sako, whom I've already mentioned. So for this part of the webinar, we would like to really hear more from them and from their first-hand experience, and really in 5 or 6 minutes each, we wanted to ask you to tell us a bit, if there have been any reforms or efforts done by your country to cover agri-food system workers with social protection, either social assistance or social insurance. If you can tell us a bit about that, and what are the challenges that your country faced to cover these agri-food system workers with social protection. So we will start first with Koffi, with Eugène André, if he's online. He was having, oh yes, I see him. Koffi,
your microphone is off.
Yes.
Votre microphone est coupé, Monsieur Eugène.
Oui, vous m'entendez?
Oui.
Oui.
Allez-y, on vous entend. Alors, Koffi, je pense que vous avez un petit problème avec votre micro. Juste le temps que cela soit réglé, je vais passer la parole au panéliste suivant et je vous redonnerai la parole après. So, while Koffi Ndri manages his microphone problem, I will give the floor to George Kwadwo Osei Ababio to give us the perspectives from Ghana. George, over to you.
Good morning here from Ghana. Thank you for this opportunity. I'm a real learner in social protection. Judging from my background, let me share just something, whether I'll be able to share a screen, share something from my end here. If I can I'm able to share.
So actually, George, we cannot share.
Let me just,
we will listen to
yes,
you. Yes.
Let me. Yes, let me. Just you know, social protection is not new in Ghana, and it has. I've really enjoyed research work. It's really proven to be a reliable just tool towards reducing poverty in Ghana. It looks good, very good. We are moving on. This starts from Ministry of Gender. That's the main coordinating agency in Ghana, Ministry of Gender, Children and Social Protection. That is leading the social protection front. So government relies on this agency to coordinate all social protection activities. And there have been a lot of interventions. I'm happy I've seen them here. The interventions, in fact, we have the social protection policy, which have been developed, and it's a way of ensuring sustainability for the social protection systems. Ghana has, on social protection front, we have about 5 flagship projects. They are the LEAP, the Livelihood Employment Against Poverty, which is the cash grant. We have Ghana School Feeding Program, also was mentioned, basic capitation grant, school feeding for children, a capitation grant, a grant for the schools, and other interventions. And one major intervention is what we are discussing, the labor-intensive public works. Let me explain that, as has been said on the research, as has been just given us, our system doesn't target the agri-food workers per se. It doesn't target, but because we are dealing with vulnerable groups and poor communities, they are drawn in. So government also has some flagship programs which the labor-intensive public work comes in to support. One of them is the Planting for Food and Jobs. It's a government program. And then we have also Planting for Export and Rural Development, another government program, which is normally taking us an agri-food system, not necessarily targeting that, but it's a sort of an agri-food system. And this is where the labor-intensive public works come in. The Planting for Export and Rural Development targets 9 commodity food value chains: cashew, coffee, cotton, coconut, citrus, oil palm, mango, rubber, and shea. Through our decentralized system, the districts. So what LIPW does is to support the planting for export and rural development. So we are doing a lot in this area, and as I speak, about 11.9 million tree crop seedlings have been provided through the labor-intensive public works. Let me correct something here. The labor-intensive public works doesn't pay below the minimum wage per se. I want to explain. We have the government minimum wage, and then we have the wage paid in communities. Agri workers, they work on farms in communities. Those wages are different from the government minimum wage. And the government minimum, when the government sets a minimum wage at any time, we revise the LIPW wage to the government minimum wage and convert it to the nearest highest value. For example, recently, the government minimum wage was below 14 Ghana cedis, 14, below, a little bit below. And this LIPW minimum wage was adjusted to 14 Ghana cedis. So that is the difference. The communities are maybe protesting, are talking about low minimum wage, depending on where they are. So that is what I just want to mention. So we have also other programs, Youth in Agriculture, which is somewhat related to agri-food workers, but not as agri-food workers. And this is where the labor-intensive public works and other interventions come in to support. So back to the question, yes, reforms are taking place with what we call rationalization of the social protection sector. We are rationalizing to see even which of the interventions will work well. As we speak now, I think I provided the information. My concentration is on the LIPW. In addition to the LIPW, which is being implemented by another ministry, local government, where I'm operating, we have provided what we call productive inclusion. And the productive inclusion targets LIPW beneficiaries and then train them in entrepreneurship and then give them grants through the credits, give them grant to operate their own businesses. So that is a way, one of the major reforms, because we want the poor graduates from the poverty level, and we realize that LIPW cannot do the job. So we have introduced what we call the productive inclusion, which is a credit for communities to, individuals in communities to establish their own entrepreneurship, establish their own businesses and run them. We are hoping for sustainability. Government has shown commitment and reforms. On the research, we see 80 district assemblies participating in the LIPW and productive inclusion and other interventions. Yes, it started with 80 from 2019 to 2022. Now the districts, the poor districts have moved to 100 with another support of $100 million for the productive inclusion I'm talking about, the LIPW, and then LEAP and other social protection interventions. As I speak with you here, I'm outside Accra. We are on a meeting to discuss how development can go on there. So reforms and efforts are being done. I hope next 2 years, they will increase the number of districts. Of course, if you increase the number of districts, Ghana, we have here the regions and then the districts. The regions are a cluster of districts. So we increase the number of districts to another 120. We are trying to just reach and attempt to reach more of the vulnerable and the poor. So the agri-food systems, by and large, we are learning from here, by and large, we know how to target agri-food system, but there's this interconnection. Agri-food systems, invariably, many are found in as poorest of the poor and the vulnerable. So, the challenges, yes, targeting, getting the right people, and the fact both of the challenges have been omitted here, funding, sustainability, and how the systems should run. So I think on this note, I will end here. If there's anything we can discuss further, be available online, email, and other areas. Thank you.
Thank you very much, George, for this overview on Ghana's efforts to make links between existing programs and also bundle interventions to support the productive inclusion of beneficiaries. This was really interesting. I will now give the floor to Koffi, Eugène, and Guei, if your microphone is working now. The floor is yours.
Alors, vous m'entendez?
On vous entend, mais il y a un gros écho. Est-ce que vous pouvez... Voilà.
C'est bon? Vous m'entendez mieux maintenant?
Oui.
Je voudrais dire merci. Merci et bonjour Anna. Pour ta présence.
Monsieur Eugène, peut-être, il faudra couper le son du côté de la télé. Je crois qu'il y a des haut-parleurs dans votre salle. Peut-être si vous pouvez mettre en mute juste les haut-parleurs, je crois. Je ne sais pas si c'est sur une télé ou quelque chose comme ça. Et réessayer. Maintenant, on ne vous entend plus.
Attends, vous m'entendez mieux?
On entend toujours cet écho. Je crois que c'est... Est-ce que vous avez un haut-parleur dans votre salle, c'est ça?
Oui, nous sommes au bureau de la FAO.
Oui, voilà. Je crois que juste il faudrait couper les haut-parleurs de la salle juste le temps de votre intervention.
Attendez. Il faut couper le son.
Maybe I know we can go to Papa Malik, maybe, or someone else. I don't know.
Ça va mieux maintenant?
Non, toujours pas.
On entend toujours l'écho, Koffi. Je pense
il faut couper tout ici, là. Il faut arrêter tout ici. Je vais prendre pas d'attendre.
Exactement. S'il y a des gens qui sont avec vous, qui ont leurs ordinateurs, qui sont connectés, il faut qu'ils coupent le micro, mais aussi le son de leur ordinateur.
C'est bon? Si le son est activé ici. Vous m'entendez mieux? C'est bon?
Parfait. Allez-y.
Voilà.
OK. Merci. Ben, on a eu un petit problème technique, mais c'est rentré dans l'ordre. Je voudrais d'abord dire merci, et puis saluer la présence d'Anna. Anna, comme on le dit, c'est grâce à toi, en 2018, nous avons commencé notre projet. Et aujourd'hui, le projet a pu accoucher d'un bébé, comme on l'a dit, avec la Côte d'Ivoire. Pour répondre à la première question, pour aller plus vite, en termes de réformes et efforts faits par le pays, il faut dire qu'à partir de 2004, l'État de Côte d'Ivoire a élaboré une stratégie nationale de protection sociale. Voilà, une stratégie nationale de protection sociale qui a été validée en 2015. Et cette stratégie qui tournait autour des 4 axes stratégiques, c'est-à-dire 1, amélioration du niveau de vie des plus pauvres, l'accès aux services sociaux de base et ainsi la lutte contre la marginalisation et l'inclusion population vulnérable. Et 3, aller à un plus niveau élevé de protection sociale. Je pense que notre rencontre aujourd'hui se situe dans l'ASCA de la stratégie nationale de protection sociale, qui était d'étendre la protection sociale à plus de populations à travers la couverture maladie universelle et autres. Mais en termes de réformes et autres, la stratégie elle-même a permis d'avoir le projet filet socio-productif aujourd'hui qui se passe en Côte d'Ivoire. Ensuite, à travers le projet filet socio-productif, qui est un programme de transfert socio-monétaire à certaines catégories de population identifiées sur la base qu'on appelle d'une identification. Ensuite, à partir de là, il y a également la mise en place de la couverture maladie universelle. La spécificité de la Côte d'Ivoire en matière de mise en place de couverture maladie universelle, c'est que nous avons deux régimes. Un régime de base pour toutes les catégories de population, pour tous ceux qui résident en Côte d'Ivoire. Comme on a dit, pour notre programme couverture maladie, c'est pour toute la population qui réside en Côte d'Ivoire, y compris les étrangers et les Ivoiriens. Mais la particularité, nous avons deux régimes, dont un régime social de base qui est de 1 000 francs par cotisation par mois par adhérent. Comprenez? Ensuite, nous avons un deuxième régime qui est le régime d'assistance médicale. Le régime d'assistance médicale est destiné aux populations indigentes, c'est-à-dire l'État de Côte d'Ivoire, comme l'assurance est contributive, donc l'État de Côte d'Ivoire contribue au niveau financier pour des populations dites indigentes. Et parmi ces populations, on inclut les populations du monde rural. Ainsi, nous avons également, dans le cas de la couverture maladie également, toutes les populations du monde rural sont concernées. Mais, comme on l'a dit, on va le voir au niveau des défis. Les défis, c'est au niveau des documents administratifs pour se faire enrôler, au niveau de la collecte des cotisations, comme ce sont des populations agricoles, comment prélever les cotisations et comment améliorer les services de santé. Ensuite, nous avons 3 en termes de réforme. Il y a le régime social des travailleurs indépendants. Je pense que ça cadre bien avec l'assurance des travailleurs de l'agroalimentaire. Lors de l'étude, nous avons échangé avec l'équipe de Pedro, Gabriela et autres. En Côte d'Ivoire, il est mis en place un régime par la Caisse nationale de prévoyance sociale, NIPS, pour permettre aux travailleurs indépendants, y compris ceux du monde agricole, d'avoir une assurance en cas de maladie, d'accident et de prestations de maternité. Parce que, comme c'est un régime contributif, la plupart du temps, il faut dire que la Côte d'Ivoire, nous avons autour de 80% qui n'est pas, une population de 80% qui n'est pas couverte par des assurances et autres. Donc, ce régime permet désormais d'intégrer une catégorie de population pour bénéficier de l'assurance et autres. Donc, dans le cadre de notre projet, le projet pilote que nous avons réalisé avec la FAO sur le financement de l'Union africaine, le TCP que nous avons fini, ça nous a permis de voir une dynamique au niveau du monde rural. Donc, nous avons axé désormais notre évolution, l'extension de la protection sociale à travers les coopératives agricoles, c'est-à-dire le monde agricole. Donc, nous tombons automatiquement sur les défis. Les défis liés à la mise en place d'une meilleure assurance dans le monde agricole, ce sont les défis, d'ordre institutionnel. D'ordre institutionnel, il y a un gros problème de synergie d'action entre les acteurs. Lorsque vous voyez les populations du monde rural que vous voulez toucher, le ministère de l'Agriculture se dit non, c'est mon domaine. Vous comprenez? Alors que nous sommes un secteur transversal sur le capital humain. Pour travailler sur le capital humain, il faut créer une synergie entre les différents ministères, inclusion sociale, productive et autres. Donc, nous avons un défi institutionnel qui, si ce projet que nous allons mettre en place va essayer de régler ce problème de mise en commun de tous les acteurs. Ensuite, nous avons un défi organisationnel que nous avons découvert au niveau du monde rural. On ne peut faciliter l'accession des populations du monde rural à une assurance si cette population n'est pas organisée. Pour qu'elle soit organisée, nous avons tablé notre vision et notre politique sur l'organisation des coopératives. C'est assez simple. Une fois que les coopératives sont organisées, elles peuvent mieux commercialiser la production et on peut mieux, à travers la coopérative, identifier les membres de la coopérative et les ressources que nous allons obtenir de la vente ou bien de l'organisation des produits. Ensuite, le deuxième défi, c'est le manque de revenus, l'insuffisance de revenus ou le manque de revenus. Toutes les statistiques en Côte d'Ivoire nous disent que 76% de la population rurale est pauvre. Alors, que faire? Pas parce qu'il n'y a pas de ressources, il y a la terre, il y a la production, il y a des aides, mais il y a un problème de création de richesses. Alors, dans ce cas de projet, en organisant, en réglant le défi organisationnel, organiser les coopératives et nous allons travailler sur la chaîne des valeurs. C'est ce que nous avons fait dans le projet pilote. Permettre la création de nouvelles richesses. Donc, vous voyez, organisation, création de richesses et cette organisation et la création de richesses vient financer la protection sociale parce que nous sommes dans un système contributif. Donc, du coup, lorsque nous avons aidé à la production, à la commercialisation, nous avons aidé à l'organisation, nous pouvons maintenant aller prélever. Et du coup, nous finançons maintenant la protection sociale. Donc, pour le projet d'extension de la protection sociale que nous sommes en train de faire, nous avons pris 3 aspects au niveau de la protection sociale. Il s'agit de la couverture maladie, qui est la couverture santé. Ensuite, ça va rentrer dans le cadre de la généralisation de la couverture maladie en milieu rural. Ensuite, le deuxième aspect va concerner effectivement la généralisation, l'intensification et la génération du programme social et du régime social des travailleurs indépendants. Désormais, nos populations du monde rural pourront avoir une prestation de maternité. Ils pourront avoir une prestation en cas d'accident, comprenez, et pourront même avoir des revenus de remplacement en cas de retraite. Donc, voilà les grands défis auxquels nous sommes en train de nous attacher. Le socle de tout cela, la réalisation, nous, aujourd'hui, je peux vous confirmer, à travers, pendant ces 1 an, pendant près de 2018, nous sommes sur ce processus. Nous avons une bonne équipe qui est déjà disponible. Nous avons tous les acteurs qui ont été déjà impliqués. Le seul défi qui nous reste, c'est le volet financier. Comment démarrer ce programme? Au niveau de la Côte d'Ivoire, l'État de Côte d'Ivoire a pris l'engagement de doter ce programme de 1,950 milliard qui est inscrit. Le programme a été inscrit dans le PND, dans le programme d'investissement public sur les 3 prochaines années. Et ainsi, sur je vais dire dans tout ce qui est organisation ivoirienne. Du coup, nous attendons l'apport des bailleurs, des PTF pour nous accompagner pour la mise en place de ce projet pour que nous retrouvions une synergie d'action. Donc, c'est ce que je peux dire au niveau de la Côte d'Ivoire pour m'arrêter là.
Un grand merci, Eugène, et c'est un plaisir de vous entendre après ces quelques années. So thank you for explaining the experience of Côte d'Ivoire and the efforts to try to expand the coverage of social insurance to agricultural workers, not only health insurance, but also different branches. So this was really interesting and very interesting points on challenges related to contributory capacity, the need to support incomes as well. Thank you very much. For the next speaker, I would like to call Mr. Marcelino Monteiro from the National Institute of Social Security, Cabo Verde. Marcelino, the floor is yours.
Ok, muito obrigado, bom dia. Daqui eu vou falar um pouco da experiência de Cabo Verde no concernente ao esforço do país para assegurar que os trabalhadores dos sistemas agroalimentares tivessem coberturas da proteção social. Primeiramente, para dizer que Cabo Verde é um pequeno país, mas que enfrenta, entretanto, diversos desafios. Só para situar um pouco, para dizer que a população economicamente ativa é de 186 mil pessoas, sendo que 74% da população reside no meio urbano, 25% no meio rural. Também convém realçar que a incidência da pobreza absoluta é de 26%, e que já que estamos a falar do sistema agroalimentar, convém relembrar que a atividade de agricultura, pesca e pecuária tem um contributo muito reduzido para o PIB, de 9,6%, enquanto que empregam cerca de 20% da força de trabalho. Para falar dos esforços do país, convém começarmos desde o início, voltar para o ano 2001, quando o país enfrentava uma baixa taxa de cobertura da proteção social. Então foi decidido começar com reformas, e estas reformas começaram com a aprovação da Lei de Bases, que criou um dispositivo permanente de proteção social, que foi estruturado em 3 pilares, sendo o primeiro pilar a rede de segurança, que é gerido pelo Centro Nacional de Pensões Sociais. Depois temos o segundo pilar, que é o Sistema de Proteção Social Obrigatório, que é gerido pelo Instituto Nacional de Previdência Social, e temos um sistema facultativo gerido pelas seguradoras. Aqui vamos voltar ao que mais interessa, vamos falar um pouco do Sistema Nacional de Proteção Social Obrigatório, mais concretamente do regime dos trabalhadores por conta própria. Este regime foi implementado efetivamente em 2003, mas enfrentou uma série de dificuldades que tornassem, digamos assim, que comprometeram a eficácia da sua criação. Isto porque no início havia uma seletividade da cobertura, e por isso o sistema, como estava definido, não atingia os seus objetivos. E entre os problemas que enfrentava era precisamente o facto de excluir os trabalhadores dos sistemas agroalimentares, ou os trabalhadores rurais. Por isso que em 2009 este regime foi reformulado, visando ultrapassar essas ineficácias. E um dos aspectos que foram objetos dessa reforma foi o facto de se concentrar no alargamento do campo pessoal dos trabalhadores que exercem de forma permanente uma atividade própria geradora de rendimentos. E esta alteração veio integrar no âmbito pessoal precisamente o regime dos trabalhadores por conta própria e, entre outros, os trabalhadores das explorações agrícolas, está claro na lei, ou equiparados, cuja atividade nela exercida se traduzem em atos de gestão e desde que tais atos fossem diretamente de forma reiterada e permanente. Tendo em atenção as especificidades dos trabalhadores do mundo rural, a alteração na lei veio clarificar os seguintes aspectos. Ou seja, passou a ser clarificou que são considerados trabalhadores equiparados às explorações agrícolas, todas as atividades e explorações de silvicultura, pecuária, hortofrolicultura, avicultura e apicultura. Também definiu como atividade permanente os atos de gestão que exigem uma atividade regular, mesmo que não seja feita a tempo completo. E também estabeleceu que os cônjuges, quando colaboram de forma permanente, passam também a poder ser enquadrados no regime. Este regime foi criado e o regime dos trabalhadores por conta própria, que deu atenção especial aos trabalhadores do mundo rural, foi criado e tem uma cobertura bastante considerável, tendo em conta que as prestações que cobre têm a ver com os cuidados de saúde, prestações de maternidade, subsídio de doença, as pensões de velhice, de invalidez e de sobrevivência. Como a taxa de contribuição é de 19% sobre um salário convencional escolhido pelo trabalhador, em que esses escalões variam de 1 a N escalões, sendo que o primeiro escalão atualmente é de 15 mil escudos, cerca de 150 dólares americanos. Porém, os trabalhadores podem pedir a isenção de contribuir, apesar do sistema ser obrigatório, podem pedir a isenção de contribuir em determinadas situações, nomeadamente em caso de rendimento reduzido. E isso é muito importante para os trabalhadores do mundo rural. Como sabemos, o país enfrenta ciclos, às vezes, de seca, faz com que os rendimentos diminuam e, portanto, os trabalhadores nessas ocasiões podem pedir a isenção do pagamento das contribuições. Convém dizer que essa alteração na lei contribuiu muito para o aumento da proporção da população total protegida pelo sistema de proteção social, já que passou em 2009 de uma cobertura de 32% para uma cobertura total em 2021 de cerca de 52,2% da população. Mas, infelizmente, ainda existem lacunas, nomeadamente no que concerne aos trabalhadores rurais, pois ainda a população rural não coberta é de cerca de 92%. Sendo que destes estão, ou seja, têm um emprego precário cerca de 27% da população, e desses conta-se que somente 5,6% têm uma cobertura da proteção social. Obrigado.
Muito obrigada, Marcelino. Thank you so much. Sorry, I took a minute to disable the translation. Thank you so much, Marcelino, for sharing the experience of Cabo Verde, carrying these reforms over 2 decades to expand considerably the coverage of agri-food system workers, creating a specific regimen that responds to their specific needs. We understand that there are still challenges ahead and coverage gaps, but these results are remarkable. Thank you so much for sharing. I will now give the floor, please, to Mahmoud Ali Sako from the Jigi Semejiri program in Mali. Mahmoud, the floor is yours.
I think Mahmoud wasn't here, Anna, so I think it's Papa Malik for the next one.
Ah, sorry. Papa Malik Ning, c'est à vous. Merci beaucoup. Je vous donne donc la main pour nous parler de l'expérience du Sénégal. Merci beaucoup.
Voilà, merci beaucoup et félicitations, mes encouragements ou bien et les encouragements aussi de l'autorité pour cette belle initiative. Je pense que vous nous donnez l'occasion de discuter sur les meilleures pratiques, mais surtout des réformes potentielles, concrètes qu'on peut amener pour étendre la couverture des régimes contributifs, non contributifs aux groupes les plus vulnérables, surtout dans un contexte de crise qui se chevauche, crise alimentaire, crise sanitaire. Mais je vais être très, très bref pour répondre aux 2 questions qui nous ont été posées. Moi, personnellement, d'après ma modeste expérience, je ne suis pas un expert agroalimentaire, mais je sais qu'il y a 6 problèmes que nous avons notés. En discutant avec certains amis du ministère du Travail, on a échangé sur 6 principaux problèmes. Généralement, c'est des problèmes de politique, parfois inadéquates, une faible couverture des régimes d'assurance sociale, que ce soit contributif ou non contributif. Ils m'ont parlé aussi de problèmes d'irrégularité de revenus pour le secteur agroalimentaire. des problèmes de législation, des problèmes d'organisation, mais aussi des problèmes de traçabilité des parcours. Moi, j'y ai ajouté, disons, le problème d'informalité, parce que nous savons que le secteur informel occupe une grande place au Sénégal. Inutile de pousser trop l'analyse, c'est dans toute la sous-région. Mais si je me réfère à ma pratique professionnelle dans le cadre de la mise en œuvre du programme national de bourse de sécurité familiale, je me suis aventuré à faire une analyse des chocs que traversent les bénéficiaires. Et je me suis retrouvé avec le choc inondation. Inondation qui provoque énormément de problèmes au niveau des bénéficiaires. Et quand on parle d'inondation, on pense tout de suite, disons, à l'agriculture, au maraîchage. Et nous nous rendons compte que le secteur agroalimentaire, donc les travailleurs agricoles d'une manière générale, subissent d'une manière générale encore, excusez-moi de la répétition, subissent des pertes de revenus. Et ils ont souvent recours à des stratégies d'adaptation préjudiciables, comme par exemple la vente forcée d'actifs, les prêts abusifs, ou parfois le recours au travail des enfants. Ouais. Donc, si je me réfère concrètement donc, aux programmes qui sont mis en œuvre, voilà ce que j'ai constaté. Donc, il nous faut développer encore davantage de filets de sécurité sociale à leur endroit, beaucoup plus intégrés, qui prennent en compte la question aussi de la sécurité alimentaire d'une manière générale. Alors, pour répondre aux questions qui m'ont été posées par rapport à la première question, y a-t-il des réformes, des efforts qui sont faits dans notre pays? Je pense que la première porte d'entrée, le premier effort, comme je l'ai constaté au niveau des problèmes, j'ai dit problème de politique, il fallait au Sénégal qu'on révise la stratégie nationale de protection sociale. Parce que depuis 2004, nous étions sur la stratégie. Mais au début, en 2004, il y avait un draft qui ne prenait pas en compte la question des chocs et catastrophes. Mais, et même la sécurité alimentaire n'occupait pas une place importante dans la première mouture en 2004. Mais lorsqu'on a créé au Sénégal la délégation générale à la protection sociale et à la solidarité nationale, nous avons intégré cette dimension-là. Il y a une composante à part qui concerne la sécurité alimentaire, qui concerne les chocs et les catastrophes. Donc, au moins, il y a des efforts de mise en place d'une politique cohérente qui intègre maintenant les questions de sécurité alimentaire. Deuxième effort, le Sénégal a mis en place un registre national unique. Nous avons dit que ce n'était pas suffisant parce que c'est un registre consensuel avec la contribution de l'ensemble des partenaires techniques et financiers, de l'ensemble des acteurs, de l'ensemble des sectoriels, etc. Mais nous sommes allés plus loin en institutionnalisant par décret le registre national unique qui devient ainsi un outil de mise en cohérence des différentes politiques. Troisième initiative, je ne serai pas trop long, c'est ce que nous appelons le registre simplifié des petits contribuables. Parce que mon frère de la Côte d'Ivoire l'a rappelé, il n'y a que 20, 30%, 35%. Actuellement au Sénégal, on a fait des efforts qui bénéficient de la couverture, disons, contributive, hein, l'assurance, etc., par l'État, notamment les fonctionnaires, le privé, etc. Mais il y a au moins 70, 80% de la grande majorité qui ne bénéficient pas de l'assurance. Et si nous insistons sur la mise en œuvre des filets, on se rend compte que ces types de programmes, à savoir le registre simplifié des petits contribuables, qui est à sa phase pilote au niveau du Sénégal, peut nous permettre, en tout cas, de résoudre certains problèmes. Parce que nous avons mis en place la mutuelle des artisans, ce n'est qu'une phase pilote qui couvre présentement, je crois, le risque maladie. Ce n'est pas un régime obligatoire, mais au moins on est en train de faire des pas assez significatifs pour couvrir le secteur informel. Des études aussi sont en cours pour couvrir d'autres risques et d'autres cibles. Et quatrième initiative que j'apprécie, ça c'est au niveau opérationnel, au niveau pratique, parce qu'il y a aussi la question de l'agir. Nous travaillons sur ce qu'on appelle la protection sociale adaptative. Je m'explique. Les filets sociaux basés sur le cash monétaire, que ce soit conditionnel ou non conditionnel, généralement ont un impact très limité en termes d'autonomie. En termes d'autonomie. Il est vrai qu'au Sénégal, nous avons fait l'effort de travailler sur 3 conditionnalités, éducation, santé, état civil, et qu'il y avait toujours, et il reste toujours au cœur du dispositif, un volet accompagnement pour travailler sur le capital humain, pour travailler sur le changement de comportement au niveau des bénéficiaires. Mais avec l'appui de la Banque mondiale, nous avons jugé utile d'ajouter un 3e pilier qu'on appelle protection sociale adaptative, basé sur la mise en place effectivement d'activités génératrices de revenus. Ouais. Et ces activités génératrices de revenus sont beaucoup orientées sur les questions de sécurité alimentaire. Parce que le premier poste de dépense, lorsqu'on met en place le cash, nous avons remarqué le premier poste, c'était l'alimentaire, l'achat de produits alimentaires. Donc, il y a vraiment nécessité d'insister sur la sécurité alimentaire en essayant de travailler sur les chaînes de valeur, en essayant de développer ce que nous appelons au Sénégal des alliances stratégiques dans chaque région. On identifie les opportunités, on identifie les programmes, on signe un protocole d'accord, nous apportons le cash, nous apportons l'accompagnement, les autres accompagnent l'activité génératrice de revenus. Bon, maintenant, nous sommes en train de couvrir à travers un tir groupé sur les bénéficiaires du programme, de couvrir 45 000 bénéficiaires. Il reste encore une marge, mais l'essentiel, nous sommes en train d'essayer. Et en plus de cela, ce que nous apprécions, c'est qu'il y a une couverture maladie pour l'ensemble des bénéficiaires du programme du programme de bourse de sécurité familiale. Et ça, c'est important. Donc, ils ont le cash, ils ont l'accompagnement, ils ont le productif, mais ils ont la sécurité alimentaire. Maintenant, il va falloir orienter nos pratiques vers des priorités et mettre l'accent sur la sécurité alimentaire des plus démunis en travaillant aussi sur l'assurance maladie. Pour la deuxième question, concernant quels sont les principaux défis auxquels votre pays est confronté, je pense que mes prédécesseurs ont déjà mis l'accent sur certains défis que nous partageons, à savoir la question disons, du ciblage et de maîtrise des périmètres d'intervention donc de la sécurité alimentaire. Qu'on maîtrise les données et qu'on travaille aussi sur l'interconnexion de données, donc tout ce qui pose toute la problématique du défi de la coordination de nos politiques. Deuxième défi, nous pensons que les politiques de protection sociale doivent être plus réactives aux chocs et catastrophes. Doivent être beaucoup plus réactives aux chocs et catastrophes. Qu'on soit beaucoup plus orienté vers les chocs catastrophes qui touchent la sécurité alimentaire. Et qui parle de sécurité alimentaire, parle des travailleurs du système agroalimentaire d'une manière générale. Le défi du financement, ça nous l'avons tous évoqué. Parce qu'au Sénégal, par exemple, pour la mise en œuvre du programme de bourse de sécurité familiale, parfois, il y a des retards de paiement. Il faut maîtriser son financement. Il y a des études. On a voulu mettre en place la capsule, etc. Mais la réflexion, elle est toujours là et on cherche à surmonter les obstacles financiers et administratifs des programmes d'assurance. L'autre aspect, quand on parle de défis, on ne peut pas se soustraire de l'extension de la protection sociale en termes d'élargissement des filets sociaux. Parce qu'il y a une présentation, je crois que c'est mon ami Juliano ou je ne sais qui encore, qui a parlé de 9%, les filets sociaux. Pour les filets sociaux, il n'y a que 9% qui sont, il n'y a que 9 qui sont, je crois sur 33, il n'y a que 9 qui sont orientés vers la sécurité alimentaire. Donc, il y a des efforts dans les politiques d'extension de mettre le focus sur la sécurité alimentaire et couvrir les travailleurs des systèmes agroalimentaires. L'autre défi, je pense que nous y travaillons, c'est le renforcement de l'autonomie économique des femmes rurales. Parce que vous-même, vous avez remarqué que les gestionnaires de la bourse de sécurité familiale, c'est la femme. Pour plusieurs raisons, je ne vais pas trop développer, nous comprenons tous. Donc, il va falloir relever ce défi-là, parce que jusqu'à présent, les femmes rencontrent énormément de problèmes. Donc, il nous faut travailler davantage sur l'autonomisation économique des femmes rurales au Sénégal et surtout en Afrique d'une manière générale. Et heureusement, il me semble que demain, il y a encore une conférence internationale au Sénégal sur cette question. Autre aspect, la question de la redevabilité sociale. Mon ami frère de la Côte d'Ivoire, Koffi, en a parlé. Le défi de la formalisation. Parce qu'en discutant avec les experts du ministère du Travail, ils me disent que généralement, les travaux de ce secteur-là en tout cas, ne sont pas très bien organisés. Il faut aller vers un renforcement des organisations de producteurs et améliorer l'accès des petits producteurs aux ressources productives. Moi, j'y ai ajouté la question de la redevabilité sociale. Je m'explique. Ils ont besoin d'être organisés, mais ils ont besoin aussi d'avoir de l'information. Il faut que ça soit interactif. Il faut que les politiques aillent vers eux, les formaliser, mais il faut aussi qu'on leur donne toutes les informations sur la législation, sur les opportunités, vraiment sur tout ce qui concerne le domaine législatif, le domaine organisationnel. Et cela suppose l'établissement d'un dialogue politique et la mise en place de plateformes d'échange de connaissances des organisations de producteurs. Donc voilà, il y a d'autres éléments sur lesquels nous pouvons effectivement discuter, mais je ne voudrais pas trop dépasser, je l'ai déjà dépassé mon temps de parole, mais voilà les questions sur lesquelles j'ai fait en tout cas une petite réflexion pour venir partager avec vous. Merci beaucoup.
Un grand merci, Papa Malik. Thank you so much for sharing these thoughts and reflections from Senegal. I want to highlight the points you raised on the need for an overall vision around the social policy, to also integrate insurance and assistance dimensions. This also came out in Cabo Verde. And the importance of data as well for not only targeting, but also for policy making and program design. I think these were really, really important. And like in other case studies, to highlight the need to work at the same time on the social protection aspects and then the economic inclusion aspects and the labor market aspects with formalization. Thank you so much for sharing all these experience to all our panelists. We've gone over time a bit. I don't think we have much time for questions. There is a question on the importance of enshrining in legislation these kind of social protection benefits to protect these benefits. There's another question, very thought-provoking from Anna McCord on the impact of climate change on all these reflections. I think that I will give 1 minute to João and Gabriela to give their thoughts, just 1 minute, after which I will then give the floor to Bintia for the closing remarks and Dr. Sintiki.
Yes, thank
João,
you, Anna.
Gabriela.
I'll go real quick then. Thank you for the questions as well. For the first one on the legal aspects themselves, if those are illegal, usually they are. Sometimes programs also are financed by development partners, right? So you have a lesser inclusion in legislation. But I think more the issue for implementation that we mentioned in the social assistance part is mostly linked to continuity of financing. And Mr. Eugène mentioned it a bit, right? So even if sometimes it's enshrined in legislation, priorities from the government can change, those changes can impact. You can have a new flagship program or things like that, and you end up having a lack of continuity. It's not very linked to the legal aspects themselves. Usually those are less of an issue than the financing, coordination, and things like that. On the second aspect, I'll answer also really quickly. I think it's, as we know, a great priority, and we had mentioned in this report that it's a criteria that we selected for benefits that would target, right, that would be specific to agri-food systems workers if there were shock responsive aspects, in particular for climate change. I would direct maybe for two maybe interesting programs in Niger, which is a country that's often affected by lean seasons, right? By flood seasons, by a lot of climate change related issues. They have a specific program that we have in the report. When it comes out, you'll be able to see it a bit more, but also you can look at it. It's the DNPGCA. In English, it would be the Support Plan of the Prevention and Management of Food Crisis Directorate. And what you have here is a mechanism to provide protection, to provide transfers, in-kind transfers, to provide public work that would allow to reduce the effect of those disasters, of those shocks. And you would also have some type of preparation. So I think there is a movement, let's say, towards including those things, which is getting clearer, right, recently. It's not necessarily very broad still in West Africa, but it's a movement that we can see in the recent years that's happening. That would be the answer from IPC-IG, and now I'll give the floor back to you, Anna. I went a bit over 1 minute, but not too much.
Thank you so much, João. So I gather these were thoughts from you and Gabriela. So I will now give the floor to Bintia for the closing remarks. Sorry, I don't see the screen anymore. So Bintia Stephen Tchicaya, if you want to open your mic.
Yes, I'm here. Can you hear me?
Yes, loud and clear.
Okay, perfect, Anna. Thank you so much. I would really like to thank Anna, all the panelists, Dr. Sintiki, Dr. Guei, the FAO Sub-Regional Coordinator for West Africa, all the participants. We have appreciated your contribution today. We are going to integrate some of the learning points that we will take away from this webinar, include them in the report, and send the report and send you the final copy, integrating your views and your contributions today. So this is really greatly to thank all of you. I think we have heard from ECOWAS Director for Social Protection, Dr. Sintiki. Our main aim in FAO is really to support member countries in ensuring that they do have a social protection system in place. And when they do, that they are effective and that we are able to strengthen and reap the most benefit for the extreme poor. Because indeed, social protection is to target the extreme poor, which is very important. Beyond the poor, you also have a layer of extreme poor, and social protection is to target those. And you would recall that in February 2022, the AU heads of states approved the AU Protocol on Social Protection and the Rights of Citizens. And we are counting on all of you panelists that are also representatives and that are in social protection areas in your distinctive governments to be the champions, so that we can have at least 15 countries ratify this protocol so that social protection can become a human right for us in West Africa as well. So we are counting on you to champion this, and FAO is always ready to support you and support the government and our member countries into putting in place a good social protection system for the most vulnerable, and especially the ones in the rural areas. So I would like to thank all of the participants, and then also, of course, our host today, João. I don't want to forget anybody. Jane, I don't see Jane anymore, but I will really like to thank all of your contributions today and all of your support in putting together this webinar. It has been months of long labor. My colleague Fatumbai, who has been your focal point throughout these months of putting together the study. I would really like to thank all of you for all your support and all your assistance. And we look forward to additional webinars in the coming future. And of course, Anna today, who used to be our former colleague in FAO, who has now moved on to WFP. We are all together in Dakar, Anna, so we look forward again from the West Africa sub-region to continuing supporting ECOWAS. And I'm sure when Fatwe and I get back to Dakar, we will touch base. I would really like to thank you, Anna, for all your support today. So thank you very much.
Thank you so much, Bintia, for these words. I will now give the floor to Dr. Sintiki. She was online just a second ago.
Yes, I'm online.
Great, the floor is yours.
On behalf of the ECOWAS Commission, I want to thank Bintia and her team from FAO, and WFP is here. The researchers, the partners who have worked with FAO to undertake this research and share the results with us today, and all the panelists and the distinguished experts that have participated in this webinar. This is a very unique webinar because it doesn't just bring the researchers to share the results with us. As ECOWAS, we are particularly thrilled that FAO and partners have brought distinguished experts from our member state, Cape Verde, Mali, Côte d'Ivoire, and Ghana to share their experiences. So this is a unique package. This is a unique webinar. We have understood the vulnerabilities and the risks of agri workers and rural households. And also we've all been able to, hear about all the good practices that are taking place in our region. Even though we are not very happy in West Africa with the 10% social protection coverage within our region, but I think we can leave this webinar particularly committed to moving the process forward, but also commending some of our member states that are doing considerable well in trying to address risk and vulnerabilities of rural workers, agricultural workers, and particularly meeting the needs of women and youths within our region. As ECOWAS, we are committed to continuing this dialogue of social protection. It has become so important, not only for our region, but also it's a commitment that our heads of state have made by adopting the African Union Protocol to Human Rights Charter of People's Rights, of peoples on the right of citizens to social protection and social security. The only way we can translate this commitment that the heads of states have done is to move on with this agenda in terms of finalizing our social protection framework and also our plan to bring regional experts to share best practices on what is happening in the region, as we need this type of peer pressure to be able to make sure that we galvanize support and increase our social protection coverage. So congratulations today, and we look forward to your continued support, FAO. We welcome WFP, and we could continue to work with our member states to move this very important agenda that is for our region. Thank you, and congratulations.
Thank you very much, Dr. Sintiki. We have now arrived at the end of the webinar. So on behalf of all the organizers, I just want to thank all the panelists as well as all the attendees. Thank you so much for being so active in the chat and in the question box. I'm sorry we couldn't address all of your questions. There will be a post-webinar survey. We ask you to please fill it out if you can, and all the recordings and the report will be posted on the page of the webinar. Thank you all so very much, and have a good day. Au revoir.
Very much.
Thank you. Thank you. Au revoir.
Thank you.
Merci beaucoup et félicitations. Bonjour à ma sœur Fatou.
Merci beaucoup.
Merci beaucoup. Allez, à bientôt.
Merci.
Bintia.
Bonjour, Pape Malik.
Bintia, j'espère qu'on aura l'occasion de se voir.
Oui, compromis.
Il paraît que demain, ils vont parler de l'autonomisation des femmes rurales à Dakar encore. Allez, à bientôt. Merci.
Merci.